Hi, my name is Jenna Schantz, and on this project, I did it on a former client I had. I worked with her in the fall 2021 semester through St. John's Speech and Hearing Clinic. We did our services through teletherapy. Some background information on AP is that she is a 68-year-old female living in Queens, New York with her goddaughter. AP lives on the first floor and her goddaughter lives on the second floor just in case anything happens. AP is also not married and does not have any children. She is a retired history professor from Queens College, and she taught there for 30 years. And her interests include Black history, traveling, and politics. She loves anything to do with travel and also American history. AP was initially admitted to St. John's Speech and Hearing Clinic in Queens in the fall of 2018 for 45-minute sessions. Following a TBI from a car accident in 2018, she presented with mild anomia, memory deficits, word retrieval difficulties, and disfluencies. She told us she was in a coma for 3 days, and she was in the passenger seat when the accident happened. The car slammed into a tree. In spring 2020, when COVID hit, AP switched to speech therapy through teletherapy for 45-minute sessions. And I worked with her in the fall of 2021, so she has been doing speech at St. John's for 3.5 years. She tells us that doing speech therapy helps her keep her mind busy and active. AP's medical history showed that she had a traumatic brain injury to the temporal lobe from a severe car accident in the summer of 2018. And as a result, she now suffers from seizures and takes anticonvulsants once a day. During the time I had her, in fall of 2021, she experienced 2 seizures over teletherapy. This was due to the bright background of the visual stimuli and the PowerPoint slides. As a result, she gave herself a few minutes to take her medicine to stop the seizure. When speech did resume, the clinicians decided it was best to not continue with any activities due to the client's recent experience. However, she did engage in spontaneous conversation with the clinicians and clinical educator. My clinical educator did notify her goddaughter and called her and told her what happened during speech. But after this, speech was canceled for the day. Her allergies also include augmentin, bacitracin, and neosporin. She had surgery for her scoliosis, and she beat stage 3 breast cancer. Some additional findings I have is that she had a neurophysiological evaluation for memory and word finding difficulties in the context of probable localization related to her epilepsy. Attention, problem solving, concentration, planning, calculation, because she's easily distracted and her mind wanders. She also has seizures and complains of dizziness and poor appetite. She is depressed and anxious. She has good cognitive functioning, but her executive functioning was below expectations. For example, step by step in the morning. She has difficulty with step by step what to do in the morning, to brush her teeth, go to the bathroom, get dressed. Some other testing is that she did well on alphanumeric set switching, and she did well on copying a complex geometric figure during an executive sorting task, but she did extremely low range on task verbal inhibition, switching, and difficulty generating words according to a letter queue. So for example, she would not benefit from playing Scrabble, which is why we did not do that with her during therapy. She also has mild relative weakness in frontal systems functioning based on her letter fluency, inhibition, switching, and she has non-perservative errors on a sorting task. She has weakness in executive functioning and anxiety, and she improperly encodes information in everyday life, contributing to her subjective memory complaints and word finding issues. The goals I have presented for AP were appropriate for her, and she did achieve both of these goals at the end of the semester with a great success rate. The long-term goal we used was the client will improve memory recall abilities to maintain her activities of daily living and conversational communication. The two short-term goals that we used were the client will improve fluency in conversational communication with 80% accuracy with minimal cues, and the client will improve memory recall skills with 80% accuracy with minimal cues. So our goal for her was to minimize her memory problems in everyday life, also using behavioral strategies to eliminate distractions and focus on one thing at a time, and practice perspective memory, for example, remembering to remember. The first short-term goal we worked on with AP was fluency. She was asked to fill in the blanks to 20 common phrases and sentences. In order to assess her fluency, she was provided with 20 common sentences and phrases. She was given verbal stimuli and asked to identify the missing word that would correctly complete the sentence. So for example, she was presented with a common phrase, head, shoulders, knees, and blank, and was cued to correctly respond to toes. However, when experiencing difficulty during the task, her speech would become disfluent and include fillers such as and repetitions of whole sentences, part word, whole word, and phrase repetitions. She was cued to elongate the initial syllable for given words. For example, head, shoulders, knees, and toes. Looking at the picture at the top, it says to inhale, and then exhale and speak. And those are some of the strategies that we taught her during therapy. Also, during structured reading, her disfluencies were not noted, but during spontaneous conversations, the severity of her events did increase. These are some of the examples that we did present AP with to target her fluency, as mentioned in the slide before. For example, we gave her 10 sentences of phrases. For example, a pair of blank, she would pronounce it as a pair of shoes. Peanut butter and jelly. Close the door. How was your day? A queen sleeps on a throne. The elephants live in the zoo. Head, shoulders, knees, and toes. I usually watch TV in my living room. I woke up at 5 o'clock every day. My sister likes to dance. The pictures on the right show some target pictures that we used to show her: slow rate, light contact, easy starts, pausing, stretchy speech, and to give a full breath. AP's second short-term goal targeted her memory recall skills. So now she was asked to view 2 pictures for 20 seconds and was asked to answer 10 true-false questions and 10 WH questions based on her recollection. This was also at an 80% accuracy level to sharpen her mind, and data was collected based on the number of correct responses out of the number of provided opportunities. So to assess her memorization ability, she was presented with the visual stimuli for 20 seconds. When the time was up, the visual stimuli was removed and the clinicians asked her to answer accompanying questions. For the first picture I will show you in the next slide, AP was presented with a picture of a family at an airport and was asked questions such as true or false. For example, there were 4 people in the picture, true or false, and the dad was holding the baby, true or false. And in the other picture I will show you, she was presented with a picture and asked WH questions such as who was on the mural. In this slide, we presented AP with this picture for 20 seconds, and we asked her to memorize as much as she could from the picture. After the 20 seconds was up, the picture was removed and she was shown this slide of 10 true-false questions, and she was asked to answer them to her best ability. There were 4 people in the picture. The dad was holding the baby. The mom had a hat on. The little kid had a hat on. The family was at a carnival. The family was in an airport. There was a bird flying in the air. The little kid was sitting on the floor. The mom had a green shirt on, and the dad is wearing a backpack. After she told us her answers, true or false, we gave her the correct answers. This is another picture we presented AP, and we asked her to memorize as much as she could from the picture because she would have to recall them in the next slide. Following the 20 seconds, the picture was removed and she was shown this slide of WH questions. For example, what was the girl wearing? What was the boy wearing? Who was on the mural? What was the girl looking at? And what color was the fire hydrant? And depending on her answers, they would be right or wrong, and then we would give her the right answer. In targeting AP's anomia, we presented her with a semantic feature analysis through teletherapy. Semantic feature analysis is a therapy technique that focuses on the meaning-based properties of nouns, and it also has been shown to generalize or improve word finding for words that haven't been practiced. So for example, we gave her the main picture in the middle, which was the blender, and her job was to fill in the surrounding categories. For example, what would be the verb, function, location, and place where you can find this, the category, and the personal association, as well as the feature. Some example would be a verb is that it grinds, mashes, or purees. The function is that you use it for smoothies or milkshakes. The location or place can be found in the kitchen. The feature would be on the counter, in storage, or in cabinets. And a personal association could be kitchen or juicing. And a category could be kitchen appliance. So her job was to fill in the outer part of the picture. In this slide now, we presented AP only with the outer categories, and she had to fill in the inner box. For example, there was a question mark in the middle for her to figure it out. The verb is storage or compartment. The function is stores money and documents. The location and place could be in your pants pocket or purse. The feature, counter, bag, or pocket. A personal association can be money. And the category can be a personal belonging or necessity. So her job was to use the outer categories to figure out the inner box, and she figured it out, and it was wallet, and she was correct. In this slide, I have given the G codes and the IC10 codes for my therapy session. These codes are used when billing for procedures. It is also an official system to assign healthcare codes describing diagnoses and procedures in the US. And it is also used to code and classify mortality data from death certificates. So the G code, the 2 G codes I have are G9162. One is for spoken language expression functional limitation, current status at time of initial therapy treatment, and episode outset and reporting intervals. And the second is G9169 for memory functional limitation, projected goal status at initial therapy treatment, outset, and at discharge from therapy. And I have 3 ICD-10 codes. The first is F98.5 for adult onset fluency disorder. The second is F06.8 for mild memory disturbance due to known physiological condition. And the last is Z87.820 for personal history of traumatic brain injury. Lastly, I have listed my references. The first one is the current text from this year, and the last three are the 3 peer-reviewed research articles. And I hope you enjoyed my presentation.